Hey, Balance Nation, it's Dr. AGB, and it's a balmy day here in Central Florida. And so my fun time today over at Disney got a little botched due to a rainout, at least for a little while. Anyway, so I figured I'd come on here because I was answering a couple of questions in the submitted questions for discussion in the group, and two of them had some relationship to IV chelation realms. Okay, so here's the deal. Let me break something down for you, because one of them I answered with some all caps and some exclamation points. Whenever I do that, that means it's serious business. Everything else, I'm just kidding. No. So here's the deal, guys. IV nutrition. Intravenous nutrition. The first thing you got to understand is that the body has the ability to take in nutrition la boca, okay? Through the mouth. It's just the way that works, okay? It's amazing how our divinely created bodies were meant to take in things through the mouth to provide us with things that are not self, that which we have to turn into self. Okay? So that's the way I look at things. The second thing is everything per Balance Protocol will ultimately boil down to a la Tesla, mysteries of the universe, energy, frequency, and vibration. Okay? So when I think about nutrition, much less IV, which I'll get into here in just a second, remember, it's one of the 4 factors of Balance Protocol. It is covered in Key 1 of Balance Protocol as one of the 6 environmental inputs. Okay? So nutrition is important. Make no mistake about it. I mean, it's been central to my entire life's being. That's kind of one of the reasons why I got into medicine, is because I was a chef for 12 years. I love food, and food is medicine. And I take that very seriously. So many other people, they'll just say that, and then they'll sell you a pill, potion, and powder, dietary supplements, right? So you got people like Dr. Josh Axe who does that, Dr. Mark Hyman who does that. So they'll use that vernacular, but then put things into pills and things. They don't really teach you through food. They give you dogmatic, one-size-fits-all things of doing that. In the realms of functional medicine, a classification of my field for the last 25 years, I see a lot of shameful business practices out there, and one of them is IV nutrition. So it's kind of a double-edged sword for me, because it does have clinical merit and a place within the context cubed of the individual. But make no mistake about it, IV nutrition is a supplement, just like any other supplement. Why do we call them supplements or dietary supplements? Well, because they are supplemental to your nutrition plan and strategies, which the vast majority of people don't have, which is why they're taking supplements. It's kind of like in insurance, you got Aflac, right, which is supplemental insurance. So if your first insurance doesn't cover the crap altogether, you need to get Aflac, okay? Supplemental insurance. So anyways, supplements are supplemental. They're not primary, okay? So let me just establish that. That's the first thing. I've told you guys before, I own a supplement company. I manufacture supplements. But you'll see I don't pimp them out all the time to anybody and everybody, because they require context, not just sales funnels and take this because it sounds good, and you need your exogenous ketones, and you need to have your collagen, and you have to have your bone broth, and you got to have your all your little stuff. I don't have to give examples. Jesus, these people. Most of these people who sell these supplements also do the good old marketing two-step, which we're all taught, and that is to talk about the problem, conflate the problem, and then come in with the solution, which is simple, quick, and easy, and doesn't require you to change a damn thing in your life, because all you really need is this thing. We see that in EMF, gadgets, dangles, and dongles, and all that kind of stuff. If you think you can pay off $10,000 in debt with $10, you are sadly mistaken. People who come to the condition that they're in do not arrive there because they didn't take dietary supplements. Okay, there's a whole lot of other things going on. And so what happens is people want shortcuts. They want to pay off $10,000 in debt with $10. So this is where the IV therapy nutrition people capitalize, because they create this whole narrative of all the terrible and heinous things of heavy metals, which can be true. And then they'll quote all the studies of how wonderful ascorbic acid is. Okay? So then they'll proceed to want to give you IV vitamin C and EDTA and other chelating agents. Okay? And they're doing that because they're treating a symptom, not treating systems. They're not treating the person. They're treating one particular aspect that they found in a lab that everyone is going to show virtually that it's there. Okay? So if you do the hair tissue mineral analysis, if you do the urine provocative challenge from like Doctor's Data, and they give you a little loaded dose of succimer or calcium EDTA, and then collect your pee, send it in, well, of course you're going to pull metals. Okay? A good 90% of people will. Back to that in a second. So the big issue here to understand is that IV nutrition has its place in rare occasions. If you were upright, if you are not debilitated, okay, then you do not need IV nutrition. You don't need Myers cocktails. You don't need glutathione drips, pushes, and all this other kind of fun stuff. Now, there's a lot of context in that. There are some people who can, when I mean upright, in other words, there are times where we do need to do something like, say, a glutathione push protocol, okay, to get that in there. Because glutathione is a different story because it's a peptide. And peptides are different than, say, vitamins and minerals and chelating agents. So again, give me some latitude on what I'm saying. Don't misunderstand. Sometimes we have to stick a needle in your arm and we have to put things into it, okay? So at the end of the day, though, with everything per balance protocol, we understand that there is a time and a place for everything within the context of the individual. And then you also have to do, which those being the right thing, but in the right or correct order, okay? Sometimes chelation does need to occur, but never, and I mean never, never, one more time, never do it at the onset of a care or program. Any clinician, functional medicine practitioner, MD, DO, DC, any other, alphabet soup at the end of their name, doing that does not know what the hell they're doing. I don't care who they are, and you can tell them I said so. The reason is this, and this should make perfect sense to all of you. When you go and you put a foreign agent, shoplift it through the vein and enforce it into the body past normal biological absorption and passes and things like that, you got to be mindful of what it's doing. Okay, you're bypassing the sheer divine intelligence of the body. So the thing about that is you're presuming that the body now has all the other systems in line to now deal with this forced induction of biochemistry. And most sick people who need the chelation are also sick in their other organs, and they don't have the ability to deal with it. I have done thousands of patients. I have done thousands of IVs, okay? It is useful, but you don't start anybody on it because, let's say, for example, lead, okay? Well, lead is principally stored in the bones, by the way. You can have a various challenges in hair that you won't see. You assume that you're assessing lead, but you're not, because you're not looking at it through the correct diagnostic. Okay, but I'm not here to teach you that. The point is that you push in certain chelating compounds or molecules into circulation, and they're now attaching, okay, through electrochemistry to these various minerals, and they're now going to have to be transported and dealt with. This is not just in circulation, you guys. You have to remember, your blood supply goes through all kinds of progressively smaller vascularity and capillaries. You got arteries and capillaries. They get so small that you can only even barely get a red corpuscle through there, okay? And oftentimes it has to be flattened out just to pass through, okay? So various things that are there attached to it are now along for the ride and are changing the chemistry of what's going on in there. You got to also understand that oftentimes in tissues, these molecules of chelating agents have to be delivered to tissues that don't have a direct, they're behind gates and doors, right? Because you got to think about it, right? Remember, just the outside of a cell, let's call it a liver cell, actually has a membrane, and then now it's got the cytoplasm inside of that cell, which is a gelatinous type thing. It's not water, just free and clear. It's a lot of electrochemistry going on in there, okay? And then there's a bunch of organelles that have their membranes also, okay? So if we're pulling out lead is a small, it's heavy, but it's a small thing. Where is that lead? See, people don't go this deep into the thought. They're just stopping at the body level. They're not even getting into the organ system, much less the organ, much less the tissue, much less the cell, much less the intracellular of where these heavy metal ions are, right? So when you're dealing with a molecule like a calcium EDTA or something of that nature, going in and out of cell membranes, it's going to affect other biochemistry. If you're not aware of everyone's relationship who's sitting at the table for dinner or who's in the restaurant, okay, well, then you're not really understanding how the chemistry is going to be affected on other aspects as it's transported out, okay? Sick people are sick people. That means all their organs can be presumed as not operating optimally. Don't put excess taxation of pulling out ionic charge that is powerfully detrimental, okay? You don't do it. It's the same reason why if someone is, laying up in bed, in the hospital, we don't give them a steak dinner, even though it's grass-fed, all that kind of fun stuff. Doesn't matter. The bottom line is they don't have the capacity to deal with it, right? When people are ill, you have to do some things, which some people say, well, that's exactly why we give it IV nutrition, because they can't break down the nutrition. That's not true, because the IV nutrition is usually not nutrition at all. It's just a couple of different substances like vitamin C or a Myers cocktail that has a few minerals in it. They're not giving fatty acids, amino acids, vitamins, minerals, enzymes, fiber, and all these other things that come from real nutrition that you actually swallow in your mouth. So understand this: heavy metals are a clear and present danger in the environment. How are you getting them? Think of that first. Where did they come from? Well, obviously you took them in the air you breathe, the fluids you drink, and the food you eat. That's where you start. Remember Balance Protocol 2358 framework. 2 questions. What do we have to add? What do we have to remove? Phases: nourish, balance, purify. Purify always comes last. After you fully nourish the patient, after you've balanced systems to be able to deal with it, then you can qualify to purify. Does that make sense? In the 5 of the 2358, nutrient deficiencies, stressors, microbes, allergens, toxins. Heavy metals is a toxin. It is one of the things that we address in everyone, regardless of the symptom or the complaint, but only in its due diligent time, in broad consideration of the context of the individual, okay? So you start with, what is the air you're breathing? What is the water you're drinking? What is the food that you're eating? See how simple that is? This is why I cover this ad nauseum in Balance Protocol Prime, to understand this, and then of course in Enviro to understand how to assess and address these things. Because if you don't address those and you just keep going back to these quack, whack functional medicine doctors who their practice is a bunch of people sitting in recliners with little tubes going in their arms because it's cool and it's sexy and it's selfie worthy on social media, and they don't teach you about air, water, light, sound, EMF, and food, well, then that's how you know that they're idiots, they're fools, and you are a fool for being fooled, especially if you've heard the words coming out of my mouth right now, okay? I have seen this wreck countless people. I just had a preceptee training call a couple of days ago with one of my MDs who had a patient who had gone to Mercola's clinic and got a bunch of IV chelation, and she's wrecked because of it. I've got another gentleman in Kill Devil Hills, North Carolina, who reached out to me, who went to a functional doc who chelated him and gave him ozone therapy and wrecked him, and now he has such an upheaval in his immune system. Even his own semen causes a reaction for him topically on his skin. That's right, we can say these words. When he ejaculates, it affects his skin topically, okay? It never happened until he started getting chelated and ozoned in the wrong context. So now this guy has a very fervent Th2 dominance imbalance, and we're having to correct that. And it's because he went to a functional doc who did that stuff. These people do that as a means of practice. It's their niche. It's their thing. It's what everybody does. They're going to be like the Joseph Pizzornos and tells everybody that toxins are the problem with everything. The bottom line is this. You also aren't correcting for the person's EMF environment, the magnetic fields and the radio frequency fields and the body voltage in these patients, or yourself, or these clinicians aren't. So you start pulling these sequestered, highly charged particles into circulation with no consideration of the exterior energetics of the individual. That's another reason and a strike against doing chelation in the absence of that. Another one is because, everybody's all caught up on the mother effer gene, the MTHFR SNP, and if you have one, you got to buy Ben Lynch's supplements to take, to correct that because you have dirty genes. Well, the thing about that is that there's all kinds of genes and SNPs that come into play far beyond just the MTHFR. But here's the deal, how your body deals with metals, by the way. That's what I'm saying. There's a lot more, okay? But let's just take that one for an example. What if you or the patient has poor methylation status that has not been Q squared, M squared, qualified, quantified, measured, or monitored, and you now force in this chelative therapy, and you're presuming the body's going to have the ability to handle with all these kind of these up needs in methylation. Man, what if they're already insufficient in copper, which is highly involved in what metals do in the body, and it's complementary, from its effeminate to its masculine energy in the dualistic way the BP looks at things, energy, frequency, vibration, of zinc. And then what's going on with magnesium and selenium? Okay, so let me give you an example that I happen to just pull up of a particular patient. Okay, so this is a particular patient who, when we take a look at the elemental markers, has a tremendous amount of lead and a tremendous amount of mercury and arsenic. Okay, well, you can look at this and not know the unique story of the patient as to why. Well, this person just so happens to be a Navy SEAL who dips Copenhagen like it's going out of style. So tobacco and cannabis, especially when you're burning it, has a tremendous amount of heavy metals to it. So all these people burning the ganja, which has its place clinically too. I'm not putting down cannabis. I think it has a wonderful potential benefit. I don't believe in burning it though. But when you incinerate cannabis and you bring it in, you're delivering heavy metals. When you're smoking cigarettes and vaping, you're bringing in heavy metals. When you are also a Navy SEAL who blows things up for a living and is shooting ammunition in a little square place called a hothouse or a shoot house, right? The range, he's kicking off a tremendous amount of these metals going through hot tubes, and explosive charges and stuff like that. So now, can they quit their job? No. Thank God they don't. Okay. But they have to deal with this. But here's the deal. But look at the copper. Okay. So you have to look at more status than just what is the heavy metals and put all the attention. And if they're there, assume that you now have to remove them. Don't do that, because in order to remove them, you require a tremendous amount of systems biology to be on board to deal with it. It's like remodeling your house. You just don't go, okay, honey, I'm going to remodel, the bathroom today. And you go in there with a sledgehammer and you start, busting things down. And you didn't even think, holy shit, what about all the dust and the crap that I'm going to have to deal with there? And where am I going to go dump all this stuff? Did you get a garbage, dumpster out in front of the yard and you arrange for that to pick up? There's just so much. If we just look at an example of we try to change something in the car or whatever, you got to take things into other considerations is what I'm rambling on that. Don't just go after the metals. Okay. I'm telling you, these practitioners who are doing this are fools. They don't know what they're doing and they're wrecking people. I'm like the guy you see the show on TV, Botched, where they got all these botched plastic surgeries, and then they come to those famous guys and they fix it. So what does that mean? There's tons of board certified plastic surgery, guys out there botching people's noses and breasts and tummy tucks and butt lifts and everything like that. So over the years, I've fixed so many botches, it's unbelievable. So I want to help Balance Nation avoid that crap, okay? By letting you know that you should never start chelation before you nourish and balance and correct for your environment, because it is a rot process with all kinds of downstream stuff. So anyways, my point is, okay, is if you take a look here and you see this copper level down here at 67, so many other processes, like for instance, thyroid is actually copper-dependent pathways. Dopamine is a copper-dependent pathway. Progesterone, testosterone, they all have copper components, okay? And with zinc, right? Now, this particular person, has, a pretty decent situation going, but take a look at this. They're already under oxidative stress, and they're kicking off oxidative pathways on their lipids, okay? So lipid peroxides. So they're already in a situation of needing antioxidants and things to keep their lipids from acting stupid in the membranes. Particularly, don't start pulling mercury and lead through those unbalanced chemistries. Does that make sense? I sure hope that makes sense. I know you guys can't answer me, but you can't do it. Okay, you have to understand that at the end of the day, there's far more at play. Okay. Man, I just can't wait. And then especially in the post when it has to do with a kid. Oh my God, don't chelate kids. Stop it. Nourish those little sons of bitches. I got 3 of them, right? So the bottom line is they have such an amazing capacity to heal with food and environmental and lifestyle changes. It's profound. I don't have to chelate kids, okay? I wouldn't say never have I. I have, after we've done our Q square, M square, and context cubed. All right. So anyways, exactly, Nora, exactly. A clinic that offers IVs that doesn't have multiple Wi-Fi routers and extenders in their clinic, and toxic LED light bulbs in there to make it nice and pretty so they can charge you more for these cocktails, okay? You don't need it. It's sexy. That's all it is. I get it. It's great for income, but it makes no difference. All right. So anyways, that's my rant on that, guys, because when kids start coming into play, that's what gets me. Okay. I understand Andy Cutler. He's dead, by the way. Won't get into that. Of course, it doesn't ever hurt to make fun of, to say something about a dead person, but very familiar. Okay. So the upshot is this. Know that there's context needed to do things like that. Just because you have something that you see in some type of test that shows heavy metals doesn't therefore by default mean you ever need to chelate it. Guess how we can chelate these heavy metals out without IVs? By repletion of the nutritive minerals whose valent charge is going to push them out. Valent charge. So in other words, we can chelate through repletion. Okay? I can push out every single heavy metal by getting a balance in your nutritive metals that are already deficient by default anyways if you got these heavy metals, which is why they're even staying in the body. Okay? So you can literally bounce off these ionic charges by getting your mineral status correct, get the energetics in your environment correct, get your hydration in your fluid environment correct, and get your immune system on board. And guess what? You become lovely and delicious. So that's today's public service announcement. Stop chelating yourself, your kids, and other people. That's it. Bottom line. All right, guys. I'll stay on here for a couple more questions now that I'm off my soapbox. If anybody's got any questions. Okay, my next question. Anyone? What you got? What you got? All right, well, I guess no one's got any love today. Got a bunch of eyeballs in here, but that's all right. Well, hey, listen, guys, if you haven't already, head over to programs.balanceprotocol.com and enroll in Balance Protocol Prime. It's free. Okay? It's free. It's absolutely free. So that will give you the tenets. So that way, I put that program together a long time ago. I just released it 2.0 because I want to make it prettier and more expansive. So you guys can understand the context of what I'm saying. Not just, well, Dr. Beck says this. Okay, or Balance Protocol. What the hell's Balance Protocol? Well, now you know, because you need to understand where I'm coming from and how I answer questions. So it's free. Why would you not? Okay, that will really help you answer questions for yourself and understand how to ask me questions and allow me to help you more things. So programs.balanceprotocol.com. Go there now. Okay. Kira says, what value in adding things like chlorella? Okay. Perfect example. Chlorella is a lovely and delicious, one of my favorites, okay, foods. But we don't get it in the normal course of diet, of course. The only way you're going to get chlorella is if you buy it and you eat it, okay, because it's grown and harvested and stuff like that, okay? So it's an algae. It's a plant. It's loaded with chlorophyll and all kinds of other minerals, which is pretty awesome, okay? Can chlorophyll chelate metals? Well, yes, it can. How? By coming in with a complex of minerals. Amazing. See, so we're back to that. Its binding capacity is nowhere anything near like a succimer or something like that. Not even close. Okay, but it's gentle. But look what else you get with it. Like if you put IV chelation molecules in there, that's all you get is that. There's nothing else that goes along with it. But with chlorophyll, you get that effect, okay? The metallos and things like that's a whole nother topic. But you're also getting the chlorophyll. You're also getting the minerals. You're also getting the protein. You're also getting some fatty acids. There's some really cool stuff that come along with it. See how you nourish and you can get it done at the same time, okay? Chlorophyll is awesome, and I consume it on a regular basis. Now, however, sometimes chlorella can kick up and flare an imbalance in the TH1 and 2 balance in people. So it's not for everything. Nora, be specific. OSR, what do you want to know? Okay, be specific about what you're asking about that. Same thing. They're all chelating agents. Okay, so I need to know what you mean. What have you messed with? I've messed with all of them, and what do I think Also, that stuff. Same kind of thing. In other words, everything that I just said in this video applies to that. Okay, Sean says, is there a good resource page that helps you know how to get requirements through food for kids, servings, etc.? Nope, Sean, there is not. Unfortunately, there's not. Nope. And the reason is because the kid's story is not in there. Okay, so there's all kinds of guidelines, right? Of course, we want to eat foods that are whole the way God and nature made them. Of course, we want to eat foods that have not been genetically modified. Of course, we want foods that don't have pesticides and insecticides sprayed on them. Of course, we want to eat varied and diverse per Balance Protocol, right? But as far as for kids and food for them, then it comes in, okay, then what will your kid eat, right? So there's more context there. The thing is we do laboratory assessments. We do assessments. We Q square M square on kids, but some are too young to actually do that. Okay, so then we just use what I call universal precautions. It's a fancy thing, just to wash your hands and eat universal precautions, and just and then feed them a variety of foods that they'll consume, right? Because they don't need a whole lot. And the weaker the constitution of the individual, the more cooked food they should consume. Okay, don't go thinking by default that raw or juiced or things like that foods are therefore more nutritious and more bioavailable. It's not true. Okay, remember, I and Balance Protocol look at food as not substances that are not self. They're not you. They have to be tuned into you. And only through resistance are they turned into you. This is the reason why when we put food in the mouth, we have to break it down mechanically. Then we have to tag it and bag it like that little old lady when you're walking into Walmart with the return, put a little stamp on it. We have all these little enzymes and chemicals that get put in the saliva. Then we swallow it down. It goes into a huge acid environment. Then it leaves the stomach and goes into a huge alkaline environment where the pancreatic and the bile salts come into play. So we have to move it through one extreme to the other. That's called resistance across the line of inertia, in order to tune and synchronize that food to your resonant frequency so you can take it up. Okay, so think of food as taking that journey of not being you, and then it has to be turned into you, and all the things that go in between when it comes like that in there. So if a person has that weak liver energy, if they have that low mineral energy, and they're sick, ill, chronic disease state, so forth and so on, they already can be presumed, not assumed, but presumed, because we have some evidence, that they have an inability to transform things into them, and they haven't been consuming them in the first place. Okay? So we mechanically break things down and properly apply heat and chemical pressure to allow that food to be uptaken. Don't try to shoplift that process, okay, by jamming it into the veins. Yeah, I'm not going to get into that, Nora, on which ones and stuff like that. Recommended daily allowances? Nope, I don't go by that, Sean, because I mean that's old and antiquated. Governmental levels when it comes to that just doesn't be there. If you are feeding a kid a varied and diverse, high quality selection criteria, food sourcing, and you're correcting their environment and all the other things per the protocol, you're going to get that by default. There are times where we do need to supplement, but we let that be guided by something that we can collect on just about all kids, and that's their urine. So we can do it in a urine sample and through a organic acids profile and do that. Yep. Okay, so does that make sense? Okay, guys. Love you, Balance Nation. I think it stopped raining. I'm going to Epcot today. Got to go be like a kid for a little bit and get out of this office. And may the force be with you. And may you please live life in balance. Catch you on the flip.